So there's this big push to create psychedelic or psychedelic derived medicines right now. A lot of it has to do with the potential for treating neuropsychiatric disorders that we have struggled to treat in new ways for a while, including depression. And there does seem to be this common thread of, psilocybin and other compounds are inducing synaptogenesis, spinogenesis. That increased level of plasticity plausibly has something to do with the enhanced efficacy of, say, therapy that goes along with that plasticity that helps treat the condition. But, as you mentioned, for something like psilocybin or LSD or DMT, there's the hallucinogenic effects. For something like psilocybin or LSD, those are going to last for hours. And so clinically, it's sort of difficult to work with those compounds in that way, just because you have the hallucinogenic effects, and you have to be committed to this hours-long event that you're going to participate in. So DMT is interesting because it's short-acting in that way, but there's a big push to create non-hallucinogenic psychedelics now. Can you comment on whether you think that's plausible? Has anyone created such a compound yet that's interesting? And is there any reason to believe that the actual psychedelic component of these experiences might be important for something like severe depression, say?
So my thought on, there's been a lot of debate about whether or not you need the mystical transcendent experience. If you look at the stuff that Robin Carhart-Harris has published about brain dynamics and resetting brain dynamics, I think that the psychedelic effects are a biomarker, if you will, or a behavioral outcome of the reset mechanism that's taking place. So how can you increase global communications in the brain and reset your brain networks without having some kind of behavioral output? So I don't think that the psychedelic effects per se are what produces a change, but they're a marker of the underlying biochemistry that's leading to the change. So that's kind of the way I see that. And so from that point of view, I don't know if you can, obviously if you came up with something that worked like an SSRI, a standard antidepressant, those have some antidepressant effects. It may well be that if you think of all the people who suffer from depression, that you could give them a pill and maybe it would cure them of depression. But I think when you start talking about some other indications, end of life, the people who are treated with psychedelics at end of life, they have a whole process where they go through mentally and look at their life and what they've done and their relationships with their siblings and significant others. And I think that's part of the process of them coming to grips with the fact that they're dying. And I just don't think you can give those people a pill and that will have the same effect. I think the same thing is true for addictions, alcohol or substance use disorders. The people that have those, they'll look at when they started abusing, when did they start their addiction, what's kept them doing it. Were there family things that happened, were there family events, bad marriages, and I think there's a need to really cogitate and look at that. And that, to some extent, is what happens in the integration phase after the drug has worn off, where then you go back. And most people that are doing this therapy feel like the integration phase is very important to tie those ends back together. So, in some cases, there was a case report by Brandup and Vanguard, Scandinavian psychiatrist years ago, a person who had severe obsessive compulsive disorder to the extent that he became completely disabled. He couldn't go to work anymore. He'd get up in the morning and he would spend 4 hours washing his hands. And if somebody flushed the toilet, he had to go wash his hands. This extreme fear of contamination. And this was a 10-year follow-up. This person was given LSD, I think, once a month for 15 months without any therapy at all, and completely recovered. People said he had a better personality after than he'd ever had before, went back to his job, was promoted. So this was a 10-year follow-up, and they said, we did no therapy. This guy completely was healed by, periodic doses of LSD. So there's a case where you didn't really need therapy, but it was, a year's worth of whatever he was, going through his mind when that was happening. So I think it kind of depends, with MDMA, which is not a classical psychedelic, you're talking about people who've been traumatized, either physical violence or rape or things like that, or wartime trauma. And though in that case, you really don't, the person really isn't isolated. You talk to the person. The idea is to get them to separate the memory of the event from the affective component so they can see it, but it doesn't come into their lives like it does before the treatment. And there's where, you just can't give a pill and make that happen. That requires some verbal therapy. So I think it depends. I think there are cases, maybe in endogenous depression where they use, a Prozac or an SSRI now. It may be that you could have a pill that would do that without any psychedelic effects. I'm not sure what the mechanism of action would be, but I don't know if you can stimulate that receptor without producing psychedelic effects because of where it is and the importance of its function.
Okay, so it's fair to say that we don't know if you could create such a drug, but you would not bank on it.
I wouldn't invest a lot of money in a company trying to do that. And there's a company trying to do that, but they may be able to come up with something that's an antidepressant for endogenous depression, but I don't think it's going to have the widespread value of treating other substance use disorder and end of life and things like that. I don't think it would have the value that a psychedelic has. And of course, all the mainstream medical people in media, they're saying, oh, nobody wants to have hallucinations. We got to cut the period short and, make it so they come in and come back out really quickly and they don't spend a lot of time there. But if you talk to people that are given a psychedelic, in most cases, they found it a very rewarding experience. So I'm not sure you really want to say, well, this isn't important and make the assumption that people don't want to have that experience. I think many people want to have that experience.
Yeah, I talked to a man named John Kostakopoulos on the podcast who did 3 doses of psilocybin to treat severe alcoholism. And he said literally after the first dose, he had never had a drink again after 6 years. But when he describes it, it's very clear that, he was rewarded by when he describes the visions he had, it was clear that they were meaningful and they were part of that process. When he describes the integration, the whole thing, there's no way that he would have elected to give that component up.
Yeah, no, I think that's true. Especially if you talk to people at end of life, cancer patients, they have an experience that gives them a new perspective. They lose their fear of death. And that's one of the oldest. Those studies of cancer patients go back into the 1960s at Spring Grove Hospital. There's no way those people would give that experience up. So I think people that say, well, where's a big need for compounds that don't produce that experience? I would temper that argument by saying I'm not sure that's really true. There may be, like I said, endogenous depression where people would just take a pill and maybe get better, like what we have now. But in these other situations with addiction and end of life and some of these other things, I think that the integration and the perspective that they gain under the influence of the substance is important to the overall therapy.